Good evening all, I am Mrs. Deepika Sri from the College of Allied Health Sciences. Today we are going to see a series of radiation therapy for gallbladder carcinoma. So radiation therapy, if you are planning to radiation therapy, the radiation team carefully plan the external beam. First thing, the radiation therapy means this use of the radiation, usually X-ray, to treat cancer. Now, for gallbladder cancer, doctors use a type of radiation called external radiotherapy. The external radiotherapy uses a machine outside the body to direct radiation beam as the cancer to destroy cell. If radiation therapy for gallbladder cancer after surgery to shrink and control the cancer for as long as possible to help reduce the symptoms. The radiation on its own or with chemotherapy, having chemotherapy helps the radiation works better but can also increase side effect. For chemotherapy, you usually have the chemotherapy during the capital. Radiation after surgery, radiation therapy after surgery is called adjuvant therapy. You might have this treatment because your surgeon thinks there maybe cancer cells left behind after your operation. Cancer cells were found in lymph nodes your surgeon took out when you had your surgery. Usually it is the course, that is series of session of radiation treatment over 4 or 8 weeks. You will have around 22 sessions of radiation therapy treatment, usually Monday to Friday. At the end of your course, the treatment, you may have a boost of additional radiotherapy. You are most likely to have adjuvant therapy as part of the clinical trials. Radiation for advanced gallbladder cancer. It is the radiotherapy to relieve the symptoms of advanced gallbladder cancer, or if it is not possible to completely remove your cancer with surgery because it has spread too far. The treatment will not cure the cancer, but it may help to shrink it or slow it down. It is called the palliative or radiation therapy. You often have this in fever fractions, and sometimes it is just one treatment. Palliative radiotherapy have fever-like side effects. So types of radiation therapy for gallbladder cancers are there are stereotactic body radiation therapy, SBRT. The stereotactic body radiation therapy gives radiotherapy from many different positions around the body. This beam meet at the tumor. This means the cancer receives high amount doses of radiation, but the surrounding tissue along get a low dose. This lower the risk of side effects. This is the one type. And planning to radiation therapy before you begin in the treatment. The radiation therapy carefully plan your external beam radiation. This means working out how much radiation you need to treat the cancer and exactly where you need it. Your planning appointment takes from minutes to hours. So this is the injection of dye. You might need an injection of contrast into a vein in your hand. This is the dye that helps body tissue how up more clearly of the scan. Before you have the contrast, your radiographers ask you about any medical conditions or allergens. Some people are allergic to the contrast. Having the scanner. Once you are in positron, your radiographers put some markers on your skin. They coach up and throw out the scanner. Then they leave the room and the scan starts. The scan takes about 3 minutes. You won't feel anything. Your radiographers can see and hear you from the CT control area where they operate the scanner. Ink and tattoo markers. The radiographers may pinpoint the sized tattoo markers on your skin. They use these markers to line you up into the same position every day. So that the tattoo marker shows they treat exactly the same area for all of your treatments. They may also draw markers around the tattoo like a permanent ink pen so that they are clear to see when the lighters are shown. After your planning session, during the time of First, radiographers, doctors decide the final details of radiographer plan. They may show the area of the cancer cell will receive high dose and nearby areas receive a low dose. Thank you so much.